Good afternoon, everyone. After a few technical glitches here in 2021, we're back with Maribeth Stein on the 2021 version of her always wonderful presentation of Medicare Part D. Maribeth, thanks for being back here with us again on Zoom to do this for New Trier Township. And we beg your forgiveness for the technical glitches, but if we could resume the presentation already in progress, I'd be grateful for your help.
Thank you. Thank you for everyone for being indulgent of our technology issues. Medicare Part D, so it covers the prescription, brand name drugs, generic drugs. Everything on it has to be approved by the FDA, sold in the US, and used for medically accepted indications. So all drugs are included that are biologic products, insulin, and things like, when you're talking about people with diabetes, yes, the insulin's included, but things like test strips and syringes are not included in Part D. They are included under Part B. Also, any plan, in order to participate, has to offer at least 2 different drugs from 220 categories. So you can imagine there are a lot of drugs they have to cover, and that is just the tip of the iceberg. Every plan covers far more than those 440 drugs. They offer many different options at different tier levels, which are the pricing structure. They also offer many other generic and name brand alternatives for things too. So they each plan varies in costs and the drugs covered, and they also, as a group, the plan will negotiate on behalf of its members with certain pharmacies that are in network, so you can get any of your medication cheaper as long as you stay within the preferred network of pharmacies that your plan has pre-negotiated. Okay, let's try this and see if it works. Okay, so as with Medicare Part B, people with higher incomes have higher premiums. So this is just a chart, and I'm not going to go over it, but anyone making over, an individual making over $91,000 a year, 2 years ago, it goes by 2 years ago as income as a standard, has the standard premium of Medicare Parts B and D. Once your income starts to go up, then your premiums go up. And this is just an indication of how much that will be. I didn't go over the Part B's, just the chart, but anything on Part D, if your income escalates, your plan premium will have this additional surcharge, if you will, in the far right column added to it. So if your income, for example, if you're an single individual and your income is $100,000 a year, as it was in 2020, then your plan premium will be whatever that premium is, $33 as an average, plus $12.30 a month. Okay. If you have questions about this, it's better for us to discuss it on an individual basis. Medicare D, although you are not required to enroll in it, it is a system where if you do not enroll when you're first eligible and you choose to enroll later, there will be a 1% per month penalty for all of the months that you are eligible but not enrolled in a plan. Now, exceptions to this are people with what's called creditable coverage. Creditable coverage means that the coverage you have is as good or better than Medicare Part D offers. People who are eligible for this are people with either work, employer benefits. They can be through their own their work plan, or their spouses. They could have VA coverage. They could also have a retiree coverage. And COBRA is also often counted with Part D. It is not counted with Part B as creditable coverage, but Part D it often is. But it's important for you to check with your benefits administrator. People that have retiree plans very often won't pick up Part D because they are covered through their retirement plan. Also, union members often have an equivalent or better Medicare to Medicare Part D. They have an equivalent or better drug plan with their unions or their retiree union plans. I'm not going to go through this, but this is an example for you to review on your own. It's an example of someone that chose not to enroll in Medicare Part D when they were first eligible and how the penalty works. So go over this and when you get a second. It may or may not apply to you, but what you can see is if this is someone who chose not to enroll in Medicare for 4 years because she really wasn't on any medication, any expensive medication or any at all, and then 4 years later decided to enroll. And what it does basically is it adds 50% onto the monthly premium of cost of her plan. And that is a lifetime penalty. So every single year, every single month, you will pay that penalty on top of your monthly premium. So I always recommend to people if they're going, if they're new to Medicare and they're not taking much medication or they're taking some very inexpensive generic drugs, it's always a good idea to pick up the least expensive plan, which this year I think is $7.30, and just kind of use that as a placeholder to avoid the penalty. So remember I mentioned that there are, that each plan is required to cover certain drug categories. These are the protected categories. All plans must include all medications in these categories. So here you go. Okay, now, here. And we're going to take a pause for a moment and see if we have any questions. And then I'm going to pull up another.
And if you're muted, please unmute and please share your question with Maribeth.
Hey, Maribeth, it's Carolyn.
Hey.
I typed in, when you're talking about a retiree plan, is a teacher's pension considered part of a retiree plan? I'm really looking for my mother and myself, but my mother's
Sure.
a teacher. She's on, I think, the group plan. I'm just trying to get more information about what she needs.
Yeah, I mean, for most teachers, they do have pretty comprehensive retiree plans that include, very often they include a Medicare Advantage plan.
Yeah.
And that includes her drug coverage. So she probably wouldn't even use a D. Carolyn, you bring up something very important. With many of these retirement plans, they have what I call as the rubber band effect. So if you take your 3 fingers and put a rubber band around them, and one of the fingers is part B, one of them's part A, and the other A, B, and D. You've got all 3. If you pull any of them out of the rubber band snaps off. So what you want to make sure is that you don't do anything to disrupt that rubber band. You want to make sure that you don't enroll in a D plan outside of your retirement plan, because that will kick you out of A and B.
Wow. Okay.
Yeah.
So
yeah, big deal. Big deal.
She hasn't really been doing much adjusting. So I don't know that there is wiggle room within that rubber band.
No.
Make adjustments, or that's it.
Yeah, I mean, honestly, there is no wiggle room per se. It's what she needs to do is contact her plan administrator and make sure. My suspicion is if she's a retired teacher, she would not want to pick up a D plan.
Okay, so
she needs to stay with what she has.
Just whatever she's got, to stay with it. That's what she's gonna. Okay.
Yep.
Okay.
Because honestly, if she does anything to disrupt that, she will jeopardize her health insurance. She does not.
Yeah, I don't want to do that. Yeah, I just didn't know. Okay, that's good to know. Thank you.
Yeah, that's one of the biggest mistakes that people make. Because once you lose that coverage, you can't get it back.
Exactly.
Yeah. So just make sure you advise her accordingly. Any questions, though, she should be contacting her plan administrator through her retirement.
Okay.
Yeah.
Okay. That's good to know too. Just a touchstone of who to talk to.
Absolutely.
Thank
so
you,
I'm going to go on unless we had any other questions.
Carolyn just had messages in the chat, but it appears that you just reviewed those. So I think we're okay.
Okay, good. Thank you. I'm sorry, when I'm doing the presentation, I don't have access to chat. So please alert me to those if you have.
Will do.
And we're such a small group that if you do have odd questions, as long as we're not going, stopping every 3 seconds, we can just jump in. That's fine.
Sounds good.
There are some Part D drugs that are excluded under law, and these are listed here. They are mostly things, well, let's just go over them. Anorexia, weight loss, and weight gain medications are not included in Part D. Erectile dysfunction drugs used for treatment of sexual erectile dysfunction are not included. Fertility drugs, cosmetic or lifestyle purpose drugs, drugs for symptomatic relief of coughs and colds, typically over the counter. These are, but they are not included in Part D. Prescription vitamins and mineral products. I think there's one vitamin that I found oddly, but for the most part, vitamins and mineral products are not included. A lot of the homeopathic stuff is not included, and over the counter drugs are not included. Good to remember, you are going to pay out of pocket for these. So costs, let's talk about costs. Each Part D plan can set its own rules, as I mentioned. In 2022, there are 29 different options for standalone Part D prescription drug plans. So that's why it's important to look at them. It's a lot to digest if you don't, it's easy to use on Medicare.gov. Use the plan finder, but again, you need to be a little savvy. If you don't know how to do that, there are plenty of places available to help you, and I'll go through that a little later in the presentation. But it is important to sit down with a counselor if you can't do this yourself and talk about it, just at least for your comfort, to review what your plan's doing for next year and make sure that everything is still okay. The premiums this year range from a low of $7.30 to a high of $147.80, with an average being $33. Every plan is different, and people ask me, what is the difference between $7.30 and $147.80? That's a good question. Typically, their structures come out to, their prices come out to, they may include more lower prices per month on the very expensive specialty drugs. They may offer very inexpensive or free generics, things like that. So even though this looks really scary because there's basically $140 difference between the top and bottom premiums, sometimes I've had it happen in odd circumstances, but sometimes the more expensive premiums actually on an annualized basis, when you look at all your medications, do come up cheaper. So I know it sounds really weird, but if you're taking a lot of complex medication, it's worth it to look at all levels and not just a premium when you're evaluating these plans. It's very important to look at all three factors, meaning the premium, the deductible, and the cost of your medication. They all three have to work together. No one of the three stands alone. You can't have a three-legged stool with only two legs that tips over. Drug copays depend on the tier levels. That's the system that these Part D plans use for creating copays. And then it depends on how much you've paid over the year for your drugs and how much the plan is paid. You'll go into different levels of coverage. The annual deductible, not all plans have these, but the most that any plan can charge this year is $485. And again, we just talked about this, with Part B, there is a sliding scale for premiums if you have higher incomes. So here's a little chart. Everybody learns a little differently.
We are not seeing your slides change, Maribeth.
You're not?
No.
You're not seeing anything?
We're seeing we're on the Medicare Part D overview slide right now on my screen.
Oh my goodness. Okay.
So
let me do this. Let's pause.
Okay.
And okay. I think, oh, Jack, that's because I sent it to you and I'm not using my version. Can I share my screen? Can we try that again?
Sure. It says Maribeth Stein is controlling the screen. Now your slides are changing. I'm not touching it.
We got it.
Okay. Fabulous. Okay. Super.
All right. This is what I tried to do from the beginning that wasn't working. Okay. Boy, this has been challenging, right? Every year, Jack. Every year we have this fun project.
Yes,
okay.
It is.
All right. So you guys make sure that you put your emails in chat so that I can send you a copy of this so that you can see exactly what I'm doing and have it for your files. Okay. So please put your emails in chat, and actually I can see your chat now, which is great. Okay.
Super.
So here's a visual presentation of what I use to talk about Medicare and Part D. So the initial phase is from day one of the year, and it always starts January 1st. And then it goes throughout the year until you meet your deductible, if the plan has a deductible. So during that period, you're paying 100% of the cost of your medication. Now, some plans will be flexible with that and create another level of confusion where they say, okay, well, yeah, you're supposed to pay 100%, but we're going to give you a discount here. I tell everyone, plan on paying 100% until your deductible is met. And if your plan decides to give you a break, that's just gravy. After your deductible is met, then you go into you pay 25% of the negotiated costs and the plan pays 75%. And that pretty much goes all the way up until catastrophic coverage. That's at that point, the plan pays 95% of the cost of your medication, you pay 5%. Now, everybody, because they all take different medication, this happens at a different time. It absolutely can hit someone who's taking a lot of very expensive drugs in February or March. Some people can get through December and still be in the initial coverage phase. It's all very dependent on the meds you take and the cost of those meds. So here is a slide with numbers in it that will give you some indication. So as I said, the first deductible phase goes up to $485. The second phase, once you hit that deductible, you pay 25% until you and the plan combined have paid out a total $4,430. This amount changes every year. Then you go into what's called the coverage gap. Now, this is a little confusing because that initial phase, even though it clearly says in yellow there, you pay 25% until you and the plan have reached a certain level, the plans all make up their mind in this phase to offer you a better deal than 25%. I don't know why this happened. This is something that the plans have just done. And I think it's because they realized how expensive medications are and they're trying to, I don't know, entice people to join their plan or whatever. But different plans will say, depending on the cost of drugs, you have a fixed copay for your medication in the initial coverage. So for example, and I'll get to a specific example later, but let's say you have a medication that costs, I don't know, $100 regular price, negotiated price. So technically you're supposed to pay $25 and the plan would pay $75 in this initial coverage period. Well, the plan, and they very often do, may say, you know what, we're going to make this cost of your drug, your particular drug in this category, $10. I don't know why you're not paying $25. The plan says pay 10. No one's going to say, oh, shame on you for making me pay less. No, you're going to be thrilled, right? So you'll pay your $10. Then when you get to the next coverage gap, all of a sudden the plan, and every plan does this, they will charge you what they're entitled to at 25%. So all of a sudden your $10 drug now becomes $25 and everyone's calling or up in arms saying, oh my God, my drug just over doubled. It's, 2.5 times more than it was before. Well, yeah, that's true. But the plan was entitled to charge you that $25 all along. They just chose not to. So the important thing again is when you look at your plans for next year, you look at the whole year and what you're going to pay each month and watch how your drug costs will go up. Each month, the plan will give you an explanation of benefits based on the drugs you've gotten the previous month. And you can see what phase you're in at any time. You can tell what your next month will be. You also can get a grid or a chart, a bar chart, when you do a Medicare plan finder each year and see for the whole year by month what your drugs will cost you. And it's important to look at that just for your budgeting purposes, for you to know where you stand and for you to understand what your financial commitment is going to be toward your medication for the whole year. Okay. Okay, so coverage gap. We just talked about it briefly, but there's still levels or phases of coverage. We just saw it in the chart: deductible phase, initial, coverage gap, and catastrophic. We talked about this. They're permitted to charge their members 25%. This just in words explains what I just said. And then this chart is, I'm not going to go through it. This is something you can look at in your own time, but it compares 22 to 21 and what's happened. You can see that the annual deductible went up $40, excuse me. The out-of-pockets went up in each category. So you can see at every level how much more you're going to have to spend before you go into that next level. Then each plan, we talked about this briefly, but each plan has categories under which they price their drugs. They are called tiers. Each tier is assigned a copayment or co-insurance. Do you want the difference between copayment is a dollar amount? So they'll say anything in tier 1 is $2, anything in tier 2 is $10, or a co-insurance is a percentage. And you'll typically find copayments due. Co-insurance percentages usually happen at that coverage gap period where you're talking about 25%. It's a co-insurance. It becomes a percentage at that point. And often the more expensive drugs will have a co-insurance attached to them rather than a copayment. So this is an example of someone who has a plan, a Part D plan with no deductible. And this kind of just takes you through her drugs from the beginning to the end. Of the cycle, assuming that she hits all cycles, and everybody doesn't. As I said, if you're on very inexpensive generic drugs, you may be in that initial coverage period the whole year. But as an example, look at the column that says initial coverage price. Here you'll see the atorvastatin, which is a tier 1 very inexpensive generic, is $1. Januvia, which is a very expensive specialty drug, is $47. Now, that's not 25%. 25% is $114. So you can see at the beginning, the plan is giving you a break on the 25% they're allowed to charge. Same thing with Xarelto, same thing, very expensive medication. At the 25% gap price, it comes up a lot more. So depending on if and when you get to that coverage gap, you'll stay in the initial coverage, or potentially in this person's case, this Jane will probably end up in this gap maybe around November or so. But you can see that at the beginning of the year. We're going to talk briefly about Medicare Advantage plans. So Medicare Advantage plans is Part C. No one ever calls it that, but remember at the beginning with the little puzzle piece chart, we said full coverage for original Medicare is A, B, D, and a supplement. Medicare Advantage is C. You probably wondered where C was. Medicare Advantage is C. It's the one-stop shop we talked about that includes A, B, and D. It's offered by private companies, and all Medicare services come from one place, from that private company, and it covers all of your benefits. You are not allowed to be sold, and this is super important, you are not allowed to be sold a Medicare supplement by anyone who sells you a Medicare Advantage plan. You don't need it. It's not necessary. You can't have a supplement and a Medicare Advantage at the same time. It is illegal. And I have had people come to me who said, oh, well, I'm enrolled in the supplement and Medicare Advantage. I'm like, whoa, you're not allowed to do that. Hold on. Because the way Medicare Advantage plans are structured, they're structured by copays. So instead of paying up front where you have a premium every month, like a supplement that covers everything Medicare doesn't, you pay as you go. So anytime you have a doctor visit or hospital visit or tests or x-rays, you have a copay. The Advantage plans include everything Medicare offers, but they also sometimes and often offer additional benefits. So they may offer some screening vision coverage or dental cleanings or free gym membership or non-health related benefits. A lot of them are adding home delivered meals now, or transportation for medical appointments and things like that. Worth looking into. The important thing to remember about an Advantage plan is they do have networks. So you have to work within a network and stay in network. Makes a difference if you go out of network with some of them are HMOs, others are PPOs, but if you go out of network with an HMO, your coverage level is zero, absolutely zero. They won't cover it at all. Medicare Advantage costs for medication. So some plans charge an additional premium for Part D within the Medicare Advantage plan. Most of them do not. Medicare Advantage is included in the monthly. Just like original Medicare Part D, they have formularies, they have copays, they may have deductibles. And just the important thing in Medicare Advantage plans in general, just be very aware of the plan's network. Sometimes there are mail order services, sometimes they're cheaper, sometimes they're not. All the D plans offer, or most of them offer, a mail order. Be careful with mail order. It may be convenient for you, which is fine to use it, but it's not always cheaper. It's important to look at local pharmacies versus mail order and see where you're going to get the best price. I talked about help. So if you need help with the cost of medications and Part D plan costs, there is something called the low income subsidy or extra help, and you apply through Social Security for that. You have to meet eligible guidelines for it. People are automatically enrolled if they have any of the Medicaid coverage. So if they have full Medicaid, including spend down, or a Medicare savings program, it's also called QMB. Also, people are in SSI, supplemental security income, automatically enrolled. Automatically, this comes as part of your SSI enrollment, you automatically get low income subsidy. These are some of the eligibility levels for full extra help. So if your income is below for a single person of $1,450 a month, and assets, by assets we mean cash, savings, checkings, IRAs, stocks, bonds, mutual funds, 401k, anything's convertible to cash. Does not include a house or a car. You know, things like that are not included, but anything that is convertible to a cash account, $9,470 is your asset limit, or for a couple, it's $1,960 a month, or $14,960 in the bank, or convertible cash. You're also allowed to have set aside for a burial to $1,500 in a set aside. Partial extra help is not as robust. You have similar co-payments, but depending on how close to that top end of the income limit, you may have a deductible, and you may have a co-insurance, depending on, there are many different breakdowns within those scales. But if you know that your income and assets are below these limits, it's always a good idea to apply, please, because these medication costs are often one of the most expensive things people on a fixed income have to budget for. And if you can get any help, do it. So here's again, extra help. There are patient assistance programs. These are really important. There are programs offered by the individual drug companies to help pay for their particular medications. There are two websites here that are both very helpful. There's also, and I don't know if I included it in this presentation, but GoodRx is another clearinghouse for discount coupons for medications, and it's always good to check there as well. And then there's help available with that as well. There's an organization called SHIP, which is wonderful. SHIP, like the boat, Senior Health Insurance Program. And they work with people on Medicare to help them through the process of evaluating. And Carolyn, this might be good for you, to sit down with a SHIP counselor to look at retirement plans, what works with what. Sometimes, and I'm not telling anyone to disenroll from their retirement plan, but sometimes retirement plans have changed a lot over the years. So where they originally were a great deal and the costs were low, sometimes they've escalated depending on the company, if the company is still in business, or if they had to alter their retirement program. Sometimes these retirement program costs have gotten very expensive, and sometimes it's cheaper to go to open market or Medicare and Part D. So it's worth evaluation. Teachers, not so much, but other pensions and things are worth evaluating. So, but SHIP is great with looking at those. They also can look at Part D options too. So. Here's some local SHIP counselors. North Shore Senior Center has counselors, Levy Center in Evanston, CJE Senior Life, and the Village of Skokie all have assistance. New Trier Township, Jean Rosser is the social worker there, and she can help you connect with a SHIP counselor as well, and she can work with me also. I do a lot of this counseling for people as well. So what's new in Medicare in 2022? So Medicare Medicare has added a lot of things related to COVID-19, like vaccines, diagnostic and antibody tests, the monoclonal antibody treatment. You all have gotten your new Medicare and You 2022 handbook, and there's, I think it's page 37, details all of these new COVID coverages in there. Medicare is now covering cognitive assessments to help detect early stages of cognitive impairment, including Alzheimer's and dementias, other dementias. So they'll help with diagnosis and confirm dementia diagnosis as well. Medicare now covers screening tests for colorectal cancer, and in some cases this is every 3 years, which is more frequent than it did. The new plan finder can help you compare all sorts of things. They keep adding more to the plan finder on Medicare.gov, and it's become really robust. I mean, you can actually look at Medicare supplements on it now, find home care, nursing homes, doctor comparisons. So, and you'll go there to look at and evaluate Part D plans and Medicare Advantage plans as well. There's also a 15-minute video teaching you how to use the website and to compare plans. So, and it's really good. It's done at a very basic level that's easy to understand, even if you're not tech savvy. There's live help available. I think they have a chat function now that you can communicate directly with someone and get help. And then, use the website. It can really help you evaluate a lot of things, costs, coverage details, things like that. Medicare, this year, especially with COVID and the new variants, it's very important to get your flu shot. Medicare is really talking a lot about flu shots and making sure that people get them. That it's for risk prevention. Your full cost of your flu shot is covered. You pay nothing. And then there is a link to a vaccine finder for your local, to find local flu shots. Okay, Carolyn, talk to me about that. That may be the coverage that your mother has through, Carolyn said that her mother had to pay for a flu shot. I wonder if that has to do with her retiree coverage versus Medicare.
Yeah, I'm thinking that we may need to look at it again because costs may have gone up. I think she had to pay for it last year also. That was very surprising.
Yeah, take a look. I'm surprised too.
Yeah, she went to the local, she lives near Mariano's in Northfield, and they charged her, they looked at things up, but she had to pay $65 for a flu shot.
Yeah, check and see. I mean, I'm guessing that has to do with her teacher's pension and not her Medicare, because Medicare won't charge her.
Yeah, so I'm thinking I might go to that SHIP and see if there's a better look, compare her plan to what's available outside of her whole system.
Yeah, do. Absolutely. I mean, she has that right and that responsibility.
Okay.
Never compare. I mean, very often when you really drill down and get to copays, when you're talking about if there's a hospitalization or things like that, depending on what she truly is paying, it often, I've rarely had people walk away from teachers' pension plans, but it's always worth a conversation. Always.
That's good.
Definitely.
That's good to know.
Yeah. Talk to SHIP. They're
Maribeth,
great.
you have 3 messages in chat, it appears right now. I'm seeing on my screen.
I'm not.
Okay.
We talked about recording, teacher's pension, flu shot. Do you see more than that, Jeff?
Nope. Okay, we've covered it then.
Yeah, I've been doing them as I go.
Super. Thank you.
Yeah, no problem. So takeaways. So important to know, open enrollment is October 15th through December 7th. Your changes will be effective January 1st. If you're unhappy with your plan for any reason, and now is the time where you've gotten your booklets of how your plan is going to change from this year to next, that you sit down with it, you sit down with your medication at your table, make sure everything's still covered, it's at the same tier level, and look at your costs. If you're not happy or you have some questions, seek advice from SHIP. There's an 800 number and a link to it, or your local senior center or New Trier Township can also help.
I have another question.
Yeah.
My husband turned 65, but he's still working. And I've been poring over the whole Medicare thing, and he's covered. So we haven't done anything because he's got insurance. So he hasn't signed up.
So what he has, depending on, my suspicion is he'll want to enroll in Part A.
Oh, the hospital?
It's free.
But we have HSA, we're in an HSA now.
Oh,
and I can't do
okay.
that. That's,
Yeah, then he probably won't. HSAs affect Medicare.
yeah, so once we stop the HSA, then
Yep,
we
yep.
can, okay.
And Medicare, because if he's worked, Medicare for him will be free for Part A. You can
Okay.
enroll at any time.
Okay, no penalty. Okay.
Yep, no penalty, as long
And
as he's had consistent coverage,
Oh,
which he
yeah.
has.
Yeah,
Yep.
and then D, I don't have to worry about that until
Nope,
he retires or leaves.
correct.
Okay.
Until something happens with his current coverage,
Okay.
either retirement or if he goes to another job or whatever, if he severs ties with his current arrangement and doesn't pick up insurance, then he's got to deal with Medicare. And at that point, he gets 63 days to enroll in a D plan, and he gets 8 months to enroll in B.
Okay, good.
Obviously, the only reason you'd take the 8 months is to enroll in the B is if he got some sort of severance package, or if he got a if he got COBRA. Now, COBRA is not considered creditable coverage, but you are able to use the COBRA for 8 months if it's cheaper. COBRA often isn't cheaper, it's super expensive usually, but sometimes companies will let someone retire or let them go and say, we'll pay your COBRA for X amount of months. At that time, it's worth it for you to keep the COBRA as long as you don't exceed that 8 months, because you've got cheap coverage and you don't have to start paying that Medicare Part B premium.
Great, yeah, that seems to be what I've read. So I just wanted to double check because it's so complex. There's so much involved.
You are correct. It is extremely confusing and complex. And I don't care how many times you sit through a conversation. First time it's like, oh, okay, I hear you. Second time is okay, I hear you. Third time I hear you. Fourth time, oh, it's starting to make sense. Next session, Tammy's actually going to teach because she knows this stuff by now, right, Tammy?
Well, thank you so much. I have to go, but if it's recorded, I put my number in my email. So
Got it.
Very helpful. Thank you.
Good. We'll send you a presentation.
And
Thanks so
with
much.
Mary Beth's permission, we will also put it on the township website and our resident communications section as well.
Sure.
Super. Any others? I noticed we've got a couple of other folks who've been quiet this afternoon. Anybody else want to chat with Mary Beth before she has to go on to her next meeting? I guess not. You've done a wonderful job as always, Mary Beth.
Thank you. Thank you.
And
Any questions? Anyone can call me. My information is on the slides, so I will post those, or you'll post those on your site.
okay, I'll stop the share now, if that's okay.
Perfect.
And I think we've done what we've set out to accomplish this afternoon. So,
Good deal.
as always, I appreciate your help, Mary Beth.
Thank you. Thank you. It's been my pleasure.
And to everyone who's joined us this afternoon, thank you for coming. We'll see you soon.
Take care.